it amounts to is more non-invasive therapies. So we have patients getting an outpatient procedure versus an operation, or getting a smaller operation and then going on to have radiation because of these technologies. And a few examples would be, first, in the area of organ preservation. There used to be a need to cut an entire limb off, to take off the entire breast, to cut the entire throat out, to go through a glossectomy and take the tongue off for tongue cancer, and so on. In each of those diseases I mentioned, you now do a small surgery, plus radiation therapy and chemotherapy, and you keep the organ. And so the person keeps their leg, keeps their breast, can keep their prostate if they want to, and radiotherapy can treat that. There's less colostomies, less need for laryngectomies, and all that's due to the combination therapies of a more modified surgery, adding chemotherapy and then radiotherapy. And again, with better imaging and diagnostic. There's a newer field, I would say, that's really gained traction in the last 5 years, that's come out of this world of computers, and it's been, the name's called radiosurgery. And machines now can give very high doses of radiation to a very small target in the brain, spine, liver, or lungs. Even moving targets can be radiated while they're moving in the body, like a lung tumor. And the ability to do that has allowed us, again, another tool to minimize bigger operations and minimize side effects. And so we're seeing more and more of that. This is very true in pediatrics, where we've started a program for pediatric radiosurgery at UCSD in California, where I'm from. And I would tell you that a lot of kids would come to me following a large surgery in the brain and be crippled.